professionally you need to give a lot of commitment to your patients and you're like following the post treatment support to the patients and all. So at certain times you might be missing your family commitments in it. So how do you balance a critical care doctor? How should he balance both the things and how can he prioritize?
So, it is a very tough job actually. So, at the same time, we also need to have our own family time. So, what we do in critical care medicine is we form a 24 into 7 cover. So, one is no one doctor can treat the patients.
Okay.
So, it is a critical care medicine is a 24 into 7 job. So, we form teams and so we treat 24 into 7. We have a rota, we put a rota, and if any patient in this becomes more sick, they take a senior's advice and then we go ahead with the treatment. At the same time, work-life balance is very important. I think that gives
Time management and
time management.
I know.
Yeah.
So how important is the basic life support and CPR training for the youth in nowadays?
And that is most important for us. See, we both are talking now. If I have a cardiac arrest, then knowing BLS is of no use. So our colleague or every Indian in India should know about the BLS because BLS, when the patient having a fall means has a cardiac arrest, the as soon as you do a resuscitation in the patient survival rate is very very high. So BLS is mandatory for every citizen in India, and we are doing a lot of gated communities BLS and first aid also to the patients before the expert person like a medical person arrives.
So
or
you have a
ambulance.
team who go and give the support, sir,
Yes.
from your clinic.
Yes. So we educate a lot of communities
Oh.
and schools, colleges regarding the first aid and BLS to them.
Are there any chances of getting confused when the CPR has to be given, when it is not to be given? How can someone know?
Very clear-cut guidelines are there, madam, to when to give CPR and when not to give. And I think training is important for everyone.
From what age can we teach children about the BLS and CPR, sir?
Maybe I think around 5th class or 6th class onwards, we can train them on BLS.
Good to know. Actually, we were thinking it can be learned only in a young age after
No,
some.
at least they can identify the patient who has collapsed and what to do. So BLS is nothing that emergency alerting the emergency system also, and at least doing some basic life supports.
So, in general, we all know what is BLS and CPR. వింటూ ఉంటాము చూస్తూ ఉంటాము సినిమాల్లో మీడియాలో ఆర్ మెడికల్ వీడియోస్లో వాటిల్లో ఈ రెండు కాకుండా ఇంకేమైనా ఉంటాయా సార్ ఇన్ జనరల్ పబ్లిక్ బేసికల్గా తెలుసుకుని ఉండాల్సిన పిల్లలు కానీ ఎవరైనా
Yeah. So not only BLS and CPR, we also need to know some of the first aid things like snake bite అయితే ఏం చేయాలి, what measures we have to take, dog bite అయితే ఏం చేయాలి, suppose somebody fall in a swimming pool, what we need to do, suppose somebody has a choking, what we need to do. So these are all the emergency things. Some we have a cut injury, suppose we have a sprain or a leg injury, what we need to do. So these are all the things which comes under a first aid, where before we go to a doctor we need to know what to be done.
There is a misconception in the public about the critical care treatment. Might be because of their bad experiences which they come across in their life, that వెళ్తూనే చాలా ట్రీట్మెంట్లు చేస్తారు, టెస్టులు చేస్తారు, ఎక్కువ బిల్లింగ్ అవుతుంది, తర్వాత ఏమీ లేదంటారు, ఆర్ కొంచెం హడావుడి అవుతుంది అని. సో వాట్ డు యూ సే అబౌట్ దట్, సార్?
Yes, madam. Even we see in this community, and we see a lot of incidents happening in the hospital, especially when it comes to emergency and in the ICU. Because there are what we need to do is, as I mentioned to you, we go to the patients in a patient family members in a team approach. So that will clear most of the queries.
No, basically it is not about what the family is thinking, but basically వెళ్ళడమే హాస్పిటల్లో టెస్టులు రాసేస్తారు, చాలా ఎక్స్పెండిచర్ అవుతుందని. Is it relevant that you are doing, or sometimes it's a protocol, or
most of the things what is goes with the protocol is madam, because as I mentioned to you, a patient coming with a sepsis అంటాం, ఆ sepsis కి ఈ sepsis panel చేయాలి ఇలా చేయాలని ఉంటుంది.
Okay.
బట్ బట్ ఇలా బిల్ కావాలని చేయడం అట్లాంటిది ఉండదు. బట్ పేషెంట్ కండిషన్ చేంజెస్ వెరీ స్విఫ్ట్లీ ఇన్ ద ఐసీయూ ఆర్ ఇన్ ద ఎమర్జెన్సీస్.
Oh.
సో డాక్టర్ విల్ యాక్ట్ ఆస్ పర్ దట్.
Huh.
సో అప్పుడు ద కమ్యూనికేషన్ ఈజ్ ఓన్లీ ద కీ ఇన్ దిస్ పేషెంట్స్ టు ద ఫ్యామిలీ మెంబర్స్కి. కమ్యూనికేషన్ ఈజ్ ద మోస్ట్ ఇంపార్టెంట్, and the doctor also need to know what he is dealing with this. That is
What
most
is
important.
what is required and not.
Yeah, experience is required.
Are there any
Experience
cases that patients ask you to go with the test and you say it's not required?
when the patient asks for some test, if it is not required, I say I won't do the test.
Okay.
Because unnecessary testing is not required. When it is required only, we do it.
So what could be the common mistakes people make before coming to the critical care, sir, with the patient?
And basically, why they land in critical care is, one is basically they have to keep their health, body healthy, one. So diabetes control కానీ, తర్వాత if they have a hypertension which has to be under control, and if they have symptoms, so early presentation to the hospital without they trying on their own body some medications. And BLS also is a mandatory for everyone in the community to learn.
So what advice do you have to the young doctors while choosing this critical care career?
So critical care is the most challenging job. I think the doctors who have a passion towards doing critical care only have to come into this.
So recently, did you come across any of the challenging emergency cases which you thought there were no hopes and you could handle the patient and save him?
Yeah, we had recently had a patient who had a fall from the third floor. So he had a head injury, and he came with a very poor GCS, what we say, poor that is unconscious state. So immediately we have put on a ventilator, we have done a scan for him, and we immediately done a craniotomy. Like means we have removed that bone, and then we have done a brain surgery. Then the patient is on tracheostomy now, off ventilator, and he is recovering very faster. And maybe in a week's time he will get discharged from the hospital. So see, immediate intervention is more important. And in Sigma Hospital we have 24/7 trained doctors both in emergency and in the ICU. Along with them, our whole team is geared up, like nurses, technicians and doctors. Team is good for the 24/7 coverage in the critical care and emergency services.
Thank you, Dr. Srinivas Garu, for your valuable time and the inputs you had given to our viewers.
Thank you, Andy.
Thank you.
Thanks a lot.